Okay, I'm recording, so go ahead and tell us who you are.
My name's Marti Hearn. I'm the SHINE liaison for the Northwest Florida Area Agency on Aging and Disability Resource Center, which is a nonprofit agency. SHINE, you asked me what SHINE is. SHINE is a Medicare counseling program that is free for seniors. It is manned by volunteers. In our area, the agency covers 4 counties, Escambia, Santa Rosa, Okaloosa, and Walton counties. And we have approximately 15 volunteers that work on those 4 counties. Things get very complicated for seniors when they get on Medicare. Ideally, they should get on Medicare about 3 months before they turn age 65 is when they should actually sign up for the program. A lot of people don't realize that Medicare, they do have to sign up for it. It's not automatically that they're enrolled in it. And there's several parts to Medicare. There's Part A, Part B, Part C, and Part D. And they cover different things like hospital, what services your medical provider provides, and so forth. Anyway, Medicare can be quite complicated, and that is what SHINE is for, is to help seniors navigate the Medicare system. The program is totally free, unbiased counseling. We're not insurance salespeople. We're totally unaffiliated with any insurance company. And it's a program sponsored by the federal government. In Florida, the funds come into the Department of Elder Affairs and then are dispersed to the agency that I work with to do the SHINE program.
Can the individuals go somewhere and meet with someone, or do they have to call?
Okay, the way it works is that when somebody wants the assistance of a SHINE counselor, they'll call a number, an RPSA number, our service areas number, is 850-494-7101. And that's also considered the elder hotline for our 4 counties. Anyway, when they call that number, they'll be transferred to an intake specialist that will basically take their information, their name, their address, and their phone number. And they'll ask them what particular question they have for the counselor on Medicare. And there's a lot of questions, like every year their plans could change. They could be on one plan and all of a sudden that drug isn't covered. And so now they've got to find a plan that does cover their drug and so forth. And this is how the SHINE counselor helps them. Anyway, they call in, the information's taken, and then that information's transferred to my department. There's myself and a personal assistant, and we assigned that client to a counselor that's usually in the county in which they live, so that if they need to meet with the counselor face-to-face, that is available. We've got counseling sites in all 4 counties, and so the counselor will call that person, and set up an appointment at the earliest convenience for both parties, keeping in mind the counselors are volunteers, highly trained volunteers, and then they'll meet with them face-to-face, or they may be able to resolve the issue over the phone.
Before they come to meet with these counselors, what type of information do they need on hand?
Well, one of the things the counselors will ask them to bring is a list of all the prescription drugs they're on and what doctors they prefer to use. Because the way our counselors differ from the senior calling the number on TV, when they call the number on TV regarding Medicare, they're going to be getting an insurance company that's trying to sell them on a plan, not necessarily that meets their needs. Now, the SHINE counselors will ask them for a list of their prescription drugs, what doctors they prefer to go to. And then they have a software program on their computers. We provide them with computers that they can enter that information in, and the program will analyze it and pop up with what plans. It could be through United Healthcare, it could be through Cigna, it could be through Humana. There's a variety, Florida Blue, there's a variety of plans out there that are available through various insurance companies that are called Medicare Advantage plans. And it will assist them, that program will tell them what plans cover their drugs and cover their doctors. So that way we know that they're going to be covered, their personal drugs and so forth covered by that plan. What also our software does is tell them what the plan premiums are, what the deductibles are, and so forth. So there's literally, the senior now has additional information, good information, to decide which plan I'm going to be picking rather than talking to an insurance salesman.
About what age would you say that adults need to start getting a grasp on Medicare and other insurance specifically designed for the elders?
Okay. Ideally when you're 64, because you've got to sign up. You've got to make a decision the 3 months prior to your 65th birthday. If you don't make a decision, for example, in some cases, if a senior puts off making a decision and doesn't enroll in Part B of the Medicare plan, then they can get penalized for years for not enrolling, and that money comes out of their Social Security check, which that's a really bad thing to happen to a senior, because most seniors are living on a very, very strict income, and that money, which can be anywhere from $100 to $134, that penalty is very much needed in their senior years.
Do you or the Shine volunteers help with the actual sign-up process, or do the elders have to do that part on their own?
Okay, we can help them with the sign-up process. Our counselors are all well trained in navigating a computer and the internet. They have to be. They are excellent at navigating the Medicare.gov website. So most of our seniors are not, I won't say most, I better say a lot of them are not computer literate and have difficulty signing up on a computer, on a website. That's where our Shine counselors come in and can help them. So especially if they meet with them one-on-one, they can assist them with the sign-up process at that time on the website.
For instance, with some insurance companies, there is an open enrollment process time where they're allowed to enroll, and then after the time they have to wait. Do people who are interested in the Shine program, can they access it at any time of the year, or is there a cutoff time?
Okay, Shine's year-round. Shine's, again, we're assisting seniors in navigating the Medicare system. Now, there are certain periods of time where people can sign up for Medicare. Their sign-up time, when their initial sign-up, it starts 3 months before they turn 65. And then it will go another 3 months after they turn 65. So they've got basically a 6-month window to get on Medicare and select the plan they want to be on. Now, once they're on the plan, then there's an annual enrollment period where they can change plans. And that's October 15th to December 7th each year. If something changes for them, like a lot of seniors will move here from another state, or they might be moving here from South Florida. Well, what happens is the providers that are available in this area differ from the providers that are available in, say, another state. So because there's been a change like that, there's a window of time after they move that they will have to make plans to find another provider, healthcare provider. And so that is not called open enrollment. It's a non-specific time period based on when they move to the area.
A lot of seniors go to health fairs around the community. Can they receive this information at the health fairs?
Okay, if we're there, and I do, that's part of my job, is I go to health fairs in all 4 counties. I try to be at as many as possible to get people familiar with the SHINE program. Again, this is a government free program funded by the federal government through the state of Florida, the Department of Elder Affairs, and that is available to help them navigate the Medicare system. I go to the health fairs. I hand out brochures such as this one that tells them all about what we can do for them through the SHINE program. I actually can address questions regarding Medicare fraud. That's been a big subject. I speak to groups on this subject. So they can call me at the Northwest Florida Area Agency on Aging and set up a booking for me to come in and speak to a group for that matter. It doesn't cost them anything.
I'm going to go back to your information that you sent to us.
Mm-hmm.
It says here that trained counselors provide personal and confidential assistance over at local counseling sites. When you say trained counselors, how are they trained? Okay.
Again, they're volunteers. But in order to become a SHINE counselor, it's quite complicated as compared to like just working at a food bank or something like that, which is very important. I understand that. But our counselors have to be computer literate, be able to navigate multiple sites, number one. They have to be versed at talking with people, comfortable talking with people and asking questions. They go through an extensive training program. The first 8 modules of the program are online, and it takes them at least 2 hours. It could be more depending upon their knowledge of Medicare to go through all 8 modules. Each module would take at least a couple hours. Then they go through an all-day training session with our senior trainer. And then they go for a couple of months, at least a couple of months, into mentoring with a senior SHINE counselor. In other words, they observe them, listen to them, counseling with people. They have practice scenarios they go through. So it is quite a commitment for a person wanting to become a SHINE counselor. And then there's ongoing training. Every year they have to go to 4 quarterly meetings. At those meetings we have training, and there's other training sessions available online that they have to keep up on what's happening with Medicare.
And it says that you are in 4 counties, and the 4 counties that are listed are Escambia County, Santa Rosa County, Okaloosa County, and Walton counties.
Right.
Where are maybe all of them, where are the counties that are in most need right now of volunteers?
Oh, in need of volunteers, I have a desperate need for counselors in Walton County right now. We lost our counselor that was working the Walton County market. She had medical issues and had to retire, so I'm desperately in need of a counselor, or counselors. I need more than one really in Walton County. And I just recently added a few to Okaloosa County, but I still need counselors in Okaloosa as well. I'm growing the number of counselors we have so that we can better service the public during open enrollment that October 15th through December 7th. Yeah, I'm working on that. Walton County. We desperately need counselors in Walton County.
Okay. You say that the SHINE program is an award-winning program. Mm-hmm. What award has the SHINE program won?
I know it's award-winning based on the government website they have posted, and I can't think of the name of the award right off the bat, but it has been an award-winning volunteer program. It's been recognized by multiple agencies all across the United States.
Okay, so
because
it's
available in every state, and that's something you need to know too. The original program the federal government has is called SHIP, SHIP. In Florida, that acronym was taken. So in Florida, it's called SHINE, which stands for Serving Health Insurance Needs of Elders. And so people get confused about that sometimes because they go, well, what's SHINE? I haven't heard of that. And then you say, well, have you heard of SHIP? And they may have come in from like Tennessee or up north. And they go, yeah, I've heard of SHIP. Well, it's the same program. It's Florida's SHIP program is called SHINE.
So SHINE is the
acronym.
SHINE is the small one, not small necessarily, but SHINE is the branch off of SHIP.
Yeah, well, I mean, it is the SHIP program. It's just they couldn't call it SHIP in Florida because that acronym had already been taken by it's a real estate finance program.
Right.
And so they had to call it SHINE in Florida.
Okay.
Yeah.
But it's not just one award winning, it is
right. Right. You can see right there it says Florida SHIP.
Mm-hmm. Yeah, it's a multi-award winning state government
program. Mm-hmm. Because of it being a volunteer program, it's just amazing. The volunteers are so well educated and so well trained. It's gotten awards for that. Mm-hmm.
What year did the program start? Do you remember?
I think it's been about 20 years now. Yeah, it's been about 20 years in existence.
And if you could provide just a statement or let's say a outreach statement to the community, what would it be?
Before, if you don't understand Medicare, and you're trying to make a decision as to what plan to go with, or you don't know whether to stick with the original Medicare or add an Advantage plan, then you should absolutely call SHINE and get assistance, because our assistance is totally unbiased. And there is one other thing I need to make the community aware of. A lot of people are getting familiar with this happening, but a lot of people I'm running across are not. Medicare is coming out with new Medicare cards. Everybody is going to be issued a new Medicare card with a new illogical number. It's called an illogical number because it's a combination of numbers and letters. The reason the federal government's doing this is because there was so much fraud, identity theft, and so forth. Because the original Medicare numbers were their Social Security number. So you can imagine how that left seniors open to fraud and identity theft. So what the federal government has done now is they're started issuing new Medicare cards to everybody across the whole United States that's on Medicare. And they'll have a different number. What they need to know about that new Medicare card is they need to make sure that Medicare does have their correct address. A lot of people move from another state, forget to notify Medicare of their new address, and they certainly don't want their new Medicare card getting into the hands of somebody else. So they definitely need to make sure that Medicare has their correct address. And they can do that by going to the Medicare.gov website or calling Medicare at 1-800-MEDICARE. The other thing they need to know is the cards started coming out. The new cards started being issued in April of this year. Florida is not on the first wave. From everything I've heard and been told to me is that our wave starts in June. So Floridians should start receiving their new Medicare cards in June. What you should do is when you get your new Medicare card, of course, safeguard it and destroy your old one. Your old card should be destroyed by shredding or burning. Just don't burn down your house, okay? But shredding or burning is the best way to destroy your old card, because, again, that number is your Social Security number. And they'll continue issuing these Medicare cards through April 2019. If you haven't received your new Medicare card by April 2019, you definitely need to get on the line to Medicare and tell them that, because starting January 1st, 2020, they will not be able to use their old cards, period. They can only use the new ones.
Okay.
And that's, I think, the most important thing that we're trying to get out to the seniors right now is to be on the lookout for their new Medicare cards.
Okay.
Thank you.
All right, thank you.
Thank you.
This is Marti Hearn, Shine Liaison for
Northwest Florida Area Agency on Aging. Yes. Thank you.
Thank you.